Hello everyone, my name is Atali Sang and I'm doing my disease on measles. What is measles? Measles is an airborne virus. Measles is a highly contagious viral illness characterized by fever, malaise, rash, cough, coryza, and conjunctivitis. It is a single-stranded enveloped RNA virus with one serotype. Humans are the only natural host. It survives in the air for several hours. It is classified as a member of the genus Morbillivirus in the Paramoxiviridae family. What's it look like? It looks like it is a rash that is red or reddish brown in color. It starts on the face and works its way down the lower extremities, and then results in blotches of colored bumps. Who is at risk? Individuals at risk for measles include children that are younger than 5 years old. This is because they are too young to be vaccinated, which is why it's the main cause in them, or they are at the highest risk. Others who are at risk also include unvaccinated people who can't be vaccinated for medical reasons, which we will get into later. Also unvaccinated pregnant women and those who have not received a second dose of measles vaccine, and those who have gotten the vaccine but aren't immune to it because of their immune system. Transmission. It is transmitted by airborne respiratory droplets like coughing or sneezing. It remains airborne for up to 2 hours. It can be transmitted by saliva or skin-to-skin contact like handshakes or hugs. Since it is airborne for up to 2 hours, it can be transmitted by touching a contaminated surface. It can also be transmitted by mother to baby by pregnancy, labor, or nursing. It is easily spread in doctors' offices, schools, and sports complexes, or like big groups and outings and stuff. Outbreaks can happen in areas where people may be unvaccinated or undervaccinated. Stages. There are 4 stages to measles, which include incubation, prodrome, exanthem, and recovery. The first stage is incubation. The incubation period for measles is up to 6 to 21 days. Medium is 13 days. In this stage, the virus replicates locally. The period of contagiousness is estimated to be from 5 days before the appearance of rash to 4 days afterwards. Infected individuals are characteristically asymptomatic during the incubation period, although some may have been reported to experience transient symptoms, fever, or rash. The second stage is the prodrome stage, which usually lasts for 2 to 4 days but may persist for as long as 8 days. Patients may have developed an anthem characterized by Koplik spots, which leads to the third stage, the exanthem stage, which is approximately 2 to 4 days after onset of fever. Clinical improvements typically ensues within 48 hours of the appearance of the rash. And last, the recovery stage. In this stage, the cough may persist for 1 to 2 weeks after measles. Immunity after measles virus infection is thought to be lifelong. Signs and symptoms. Signs and symptoms are like the flu symptoms or similar, which include breathing problems, fever, and vomiting, diarrhea, and dehydration. It can also include breathing problems, ear pain, and may cause skin peeling. And it infects the epithelial cells, respiratory tract, oropharynx, and conjunctivae. Fever for more than 4 days after rash. Fever subsides and then returns. And it can also cause breathing problems. And the rash, in some it may be itchy, but most not itchy. And the symptoms may last for 2 weeks. Cure. There is no specific treatment for measles, but it is better to prevent it rather than depending on treatments. But treatments may include resting and treating or preventing further complications. And these treatments may include staying hydrated in order to replace the fluids that were lost through diarrhea. So, which leads to my next slide, getting vaccinated. Since there are no specific treatments, it is best to prevent it rather than relying on treatments. And this includes unvaccinated young children are at the highest risk of measles and its complications, including death, and any non-immune person who have not been vaccinated or the vaccine didn't work. It works. And the 1 dose of measles vaccine is about 93% effective. 2 doses is about 97% in some, but 99% in most people. There might be complications or exemptions from vaccine if there is a family history of epilepsy, seizures, allergy to gelatin or the antibiotic neomycin, immunosuppressed, taking steroids, cancer patients, and blood disorder. Effects of measles. 2 studies published in Science and Science Immunology illustrate how the measles virus causes long-term damage to the immune system, which include and also include brain damage, hearing loss, and immune suppression. Measles facts. As we mentioned before, it is a highly contagious disease. One person with measles can infect 12 to 18 people, making it the most infectious disease, though it is preventable through vaccine. The first measles vaccine in 1963 had dead virus, but in 1968 it contained live virus. Number of measles cases decreased as the vaccine was licensed and then required a second dose. In 2021, measles infected an estimated of 9 million people worldwide. During the 1950s, an annual average of greater than 500,000 cases of measles and nearly 500 deaths due to measles were reported in the United States. Surveys indicated that 95% of the population had been infected with the measles by the age of 15 years. Before the introduction of the measles vaccine in 1963, the widespread vaccination major epidemics occurred approximately every 2 to 3 years, and measles caused an estimated of 2.6 million deaths each year. Most common. Measles occurs worldwide and remains a leading cause of mortality. Measles occurs predominantly in areas with low vaccination rates, particularly resource-limited settings. Common in some countries in Europe, Asia, the Pacific, and Africa. It can spread when it reaches a community in the U.S. where groups of people are unvaccinated. And right now, measles outbreaks are occurring in every region of the world. Recent outbreaks. Measles cases in 2022, as of November 17, 2022, a total of 51 measles cases were reported by 5 jurisdictions. Measles cases in 2021, from January 1st to December 31st, 2021, a total of 49 measles cases were reported by 5 jurisdictions. Measles cases in 2020, from January 1st to December 31st, 2020, 13 individual cases of measles were confirmed in 8 jurisdictions. Measles cases in 2019, from January 1st to December 31st, 2019, 1,274 individual cases of measles were confirmed in 31 states. This is the greatest number of cases reported in the U.S. since 1992. The major cases were among people who were not vaccinated against measles. Measles is more likely to spread and cause outbreaks in the U.S. communities where groups of people are unvaccinated.